Okay, well, hello everybody. This is Barry Cocheu, CEO of Wellness BioSciences RX, and what I'm going to be walking you through here today are the specific components as it relates to our healthcare program. We have had the fortunate opportunity over the years, to be able to work with some, real phenomenal people in a lot of different ways. And what I'm going to be able to do is kind of give you an overview and kind of a well-rounded look at our healthcare program. So I want to begin first just a little bit about myself. I've had an opportunity to and been blessed to have worked in this industry now for about 30 years. Got involved in 1992. Really just trying to understand how to advance, my income with the existing business I had, owned a health club and a physical therapy practice, was in the fee-for-service business or time for money business, and was fortunate enough to been approached by one of my clients who's an attorney, West Side attorney, that insisted that I meet a gentleman who'd had great success in the area of marketing and distributing wellness-based consumables. And fortunately, I took him up on that and went and checked out the overview. And I was compelled by the idea of being able to generate an ongoing revenue, as a result of what you do. And, in a few short years, you can continue to generate that revenue long term. That's really what captivated me. And really building and developing that distributor base over the course, of my first 7, 8 years positioned me to launch my own company. That company went out and focused in on delivering science-based nutritional supplementation through medical practices. That advanced us to about 4,500 medical doctors. Fortunate to have done about $400 million over the course of 12 years and sold the intellectual property of that company. And that positioned me to start teaming up with some phenomenal folks. One of them, Dr. Nimish Patel. He's an internal medicine specialist right here in the Woodlands. I can just tell you that along with all the accolades that he possesses from a medical perspective, he is a very astute businessman, very heavily involved in the everything from the genetics to the consumer when it comes to CBD and to all cannabis-based products. He's heavily involved from a political perspective in legislators here in Texas and throughout the country. And he serves as our chief medical officer and does a fantastic job, along with Dr. Nikesh Jasani, who's a board certified oncologist right here again in Houston, Texas. Probably one of the better and more advanced educators when it comes to the clinical applications of the information that you may have had a chance to hear with respect to our product and their clinical applications across the board to the endocannabinoid system and to the specific information that we know is helpful for other medical doctors. It's helpful for high-end entrepreneurs. It's helpful for people that have never even had a business. So it's a phenomenal experience to be involved with medical doctors. We've been fortunate now to have gone out and garner just under 100 of them in the short time that we've been in business. And it's exciting for us to be able to see the results that are occurring on an ongoing basis. I think that the reason that we're having traction and success as an organization is we address the problem with healthcare. You don't have to look very far to discover that the state of our healthcare system is struggling and is relatively dysfunctional now. You probably experienced a measure of it yourself in some way or form or fashion. You may not know it, though, but there are many medical professionals who are equally frustrated and discontent with the state of our country as it relates to healthcare. So the problem with healthcare is that you're forced by insurance companies to expedite appointments, maximize billings, and marginalize patients with unconventional needs. Many healthcare providers are expressing a strong feeling of discontent between what they do every day and the idea of helping others in their presence from a medical perspective, and what originally drew them to becoming a medical doctor to begin with. So this discontent is further aggravated by the pressure from the pharmaceutical companies to diagnose towards new profitable drugs, limiting or even preventing them from offering more diverse, personalized solutions that veer outside of the conventional pharmaceutical options. So the combination of these things have really, kind of ushered us into this new phase we refer to as the disease or curative paradigm. And if you look back from 2010 to 2015, you can see a pattern that begins to evolve within what we refer to as the disease paradigm, where most medical doctors in the Western part of the world and Western civilization here in North America operate. And then you look at this transition that has begun to occur that really started as we track back to 2015 to where we project it moving forward to 2025, where over 700 billion in preventative health care will be spent overall aggregately within that period of time versus where we've been in the disease paradigm. So what we really do is we focus in on the 2 million, mostly cash profitable, that will be spent by the overall time of 2015 to where we're at in 2025. So over the next 10 years, a significant shift, right? Well, if you take a look at where we've been, and you take a look at where we're going, what we do at Wellness BioSciences RX with medical professionals around the country is we simply bridge the disconnect, providing a wellness solution for healthcare professionals and organizations across the country. And we also provide that solution for individuals, entrepreneurs that want to galvanize and take advantage of the tremendous opportunity within the ongoing CBD and certainly cannabis space. So what we do and how we do that is we have a program that incorporates wellness into a practice. Okay, it doesn't have to be just a medical practice. It can be a healthcare practice for doctors of chiropractic medicine, day spas, health clubs, any B2B or business model. We can help those businesses without increasing overhead or staff really change their business model and advance it into their patients or the individuals coming to that business, advance it into their wellness paradigm, specifically as it relates in our business today with CBD. So our program is designed to really meet and enhance lifestyle modification as a means to treat or prevent disease from occurring. Provide a value-added service that directs your patients to higher quality, pure CBD alternative to dangerous drugs, and multiple clinical research and evidence supports that the use of CBD is very, very helpful. So provides your practice with an additional passive revenue stream without adding employees, increasing overhead, or patient volume. So let's take a look at the current professional model. It's a 1-to-1 ratio, 1 hour's work, 1 hour's discounted pay. We all know that, regardless of what is actually billed is not paid from third-party reimbursements, major issues. So future model is really providing wellness services and products. And you look at efforts, the efforts that you now have are now PC doubled. So professional services times cash stream, which now starts to aggregately double the amount of revenue spent for the effort that is displayed. Let's take a look at the healthcare economics and really why we're in this circumstance. You look at physicians and patients and the time, the credibility, the resources, the overhead. Beneficiaries are Merck, Pfizer, Humana, United, CVS, Walgreens, LabCorp, Quest Diagnostics. None of us would deny that. But if you look on the other side of the ledger, you'll see that physicians have an increase in operating overhead, about 18%. Malpractice premiums have gone up. Inflation has gone up. Reimbursements have gone down. So the ledger is disproportionately high in terms of who's actually benefiting today from the existing healthcare platform and who is not. So what we do is we come in to a medical practice and we provide an overall wellness environment. We have well orchestrated and well designed, very tactful pieces of art that are put up oftentimes in the physician's waiting room. We have fantastic brochures, product fact sheets, script pads that are designed to help educate with looping DVD-ROM information that's designed to help educate patients as they're in the waiting room preparing to go in to visit their physician. A letter from the physician, a patient intake form that goes through the full gamut of everything that is involved with their existing regimen as it relates to wellness, and of course, also potentially CBD, right? So what we do is we create an environment where the patient comes into the most valuable real estate that the doctor has. It's their waiting room, and they're just inundated with information around them. So by the time they get in to the examining room, if they have any interest at all, they may ask or question the physician, and the physician just responds by letting them know that they've joint ventured, they've teamed up with Wellness BioSciences RX to provide the very finest and highest grade medical grade CBD that they believe is successful and that they've used personally. It's working for them. It's the staff is all using the product, so it's a comprehensive program that enlightens the patients to a means and a way of a product that they can use to overcome sleeplessness, various types of pain or pain disorders, challenges maybe with anxiety. There's a number of different things that you've seen through the clinical application Dr. Jasani may have gone through in a previous recording that elevate and help people understand how they can use this as a means of moderating those symptoms and those challenges rather than going directly to the pharmacopoeia, the pharmaceutical, to traditional recommendation, right? So all this is comprehensive. It's done right within the practice. It increases the efficiency. It really, the patients are excited about the fact that there are medical doctors involved, and there's an economic value that we'll talk about. You know, America's use of CBD products currently, you can see this is a Gallup poll taken from June, back in June of 2019. Random sample, about 2,500 adults aged 18 and older. And really, if you look at this as living in the United States and District of Columbia, you can see that the total U.S. adults that have personally used CBD products, about 14%, 50% never, and 35% really not familiar, right? So you can look at the age categories. It's an astounding number because of all the people that we have in the United States, most people have really not appropriately been introduced to any sort of CBD product, okay? Now, the Brightfield Group projects that the CBD market will entirely eclipse the cannabis market. The top of the funnel of people that will accept and use a CBD product without the psychoreactive benefits or the psychoreactive aspect of THC is a much higher group of people. You're always going to have people that have no problem with THC from the psychoreactive perspective, but most of the people who we're working with at the top of the funnel are glad to use this particular product because it gives them the benefits of the 113 different known compounds within the cannabis plant without having necessarily the psychoreactive component that they may have a stigma against or just may not want to experience, okay? So you can see that that is a very significant number from where we are today. I think this year we'll top out at somewhere around $5 billion in spite of the fact we've had a global pandemic, which is an unbelievable number from where we were just a few years ago, just a couple hundred million. So looking out into the future of the next couple of years and seeing the projections of reputable group like the Brightfield Group is really something that I think has sparked the interest of a lot of entrepreneurs all over the country. And so the opportunity with Wellness BioSciences RX is that we believe we'll own the practitioner channel by empowering healthcare platform to capture 20% of the CBD market share. So the practitioner CBD channel is estimated to be worth about $4.4 billion by 2022. So what we know is that we can capture just a small percentage of that growth trend and do extremely well and provide a phenomenal opportunity for medical practices, entrepreneurs throughout the country with a significant way to enter into a business model, low cost of entry, but very, very high yield from an economic perspective. Let's take a look at that. The wellness-based retail revenue stream, once we've gone in and we've turnkeyed the practice, we've provided the information to the staff. Let's just take a look at the conversion ratio. 3,000 patient-based profit. From a physician practice has 3,000 patient files aggregately. Our current conversion ratio is about 17 to 18%. We rounded off to 10% on the low end to show you what these numbers mean from a conversion ratio, let's say over the first 3 to 6 months. If you have a physician practice that has somewhere between 25% to 40% profit margin based upon where they are within our compensation plan, we do operate our compensation plan somewhat uniquely in that when somebody, medical practice or otherwise, attains a profit margin in our compensation plan, they never lose it. There's no monthly requirement to sustain it. Once they have it, okay? And here's what you'll learn. We don't determine where somebody starts. It's all discount purchasing. We don't believe in forcing people to start at a specific place that we determine and then make the difference in the revenue as a company. We let our medical practices and our entrepreneurs determine that for themselves. And wherever it's appropriate for them, whatever their existing patient base is, whatever their contact base is, whatever the financial situation is, should be the determining factors, not us as a company. But you'll see that the results speak for themselves, because when you look at 10% of 3,000 patients as an example, that's going to be about 300 patients and averaging about $150 of consumption on a monthly basis. Our number is really about $229. We'll use 150. What that means is that medical practice is now generating about $45,000 of total revenue, and they're capturing somewhere between 25 to 40% of that. you can see that these are all examples of real numbers of what has taken place within our business. So somewhere between $11,250 monthly to $18,000 a month, and you can see the annual numbers reflected, somewhere between $135,000 and $216,000 to that medical practice. Now, oftentimes you're going to find some of our pain management specialists or doctors specializing in oncology, family practice, their patients will use more than just $150. And so you can strike the number that you feel is relevant, but let's take those same 300 patients using $300 a month. Now you're looking at an aggregate amount of business of 90,000. Well, you can see at 25%, it's 22,500 at a month. At a higher number of 40% profit margin is $36,000 a month. Here's what I would tell you: we know without a doubt, that our physicians are experiencing, majority of them, that 40% profit margin, because whether they start at a lower place or they typically end up there as they aggregately are having the results with their patients in a short time. So these are all reflections and examples of money that would be earned directly from a physician on their existing patient base, whatever size that is. These are the numbers that I've been sharing with you. But it gets better, because the wellness practice royalty revenue on other healthcare practices is the significant point. So if I'm a medical doctor, or I'm a person that owns a day spa, health club, whatever business B2B model I have, and I start having these types of results, what I am inclined to do is to share that opportunity with my colleagues, whether they be other medical doctors, or there are other people that own other businesses similar to mine. And I now can not only capture revenue from what's taking place within my business, but I now have opened up this unique opportunity because of our brand partner program here at Wellness BioSciences RX to capture somewhere between 4 to 8 to 12%. Again, the same philosophy is true. Once you have attained a profit margin on the royalties that are earned on other businesses that are taking place, you don't lose it. You don't have to do anything to sustain it. It belongs to you. And so we have many of our medical doctors, healthcare providers, entrepreneurs that are taking a revenue of somewhere at 40% profit margin and 12% on the royalty side, do extremely well, because that's the immediate income. This is the royalty. This is the residual income. Let's take a look as an example. A medical doctor having results, earning whatever they're earning from their direct practice. They introduce a colleague that, as you've seen, Dr. Jasani, Dr. Patel, all the physicians that make up the aggregate network that we have now, they'll turn into, right now it's right at 100. It'll turn into thousands. Why? Because other practices are seeing the social proof. They're recognizing that this has worked for the patients, most importantly, and it's worked for the economics of the practice. So let's just take an example of a medical doctor, or anybody for that matter. You could be a person who sells pharmaceutical or work for pharmaceutical companies, your medical device sales folks, corporate America, and you know that you're already seeing medical doctors and you have just one practice. And that one practice just bears 100 patients using products in Wellness BioSciences RX at $150 a month. That's about $15,000 a month in revenue. Well, you look at the royalty numbers, and it's somewhere between $4,300 and $12,960 a year. Now, I can tell you from personal experience, it's very difficult to galvanize that type of revenue on money that might be safely invested in an interest-bearing account today. Very, very difficult. So what these medical doctors do is they start recognizing what other practices start to recognize is that as that organization grows, like say from one practice to 5 practices, keeping the same concept of the patients in terms of the numbers of 100 patients, $15,000 a month, 5 practices, that's $75,000 of aggregate business going on within an entire network. Now you're generating somewhere between $1,800 a month and $5,400 a month. Well, 10 practices is somewhere around $129,000 a year. 20 practices, $259,000. So you've got medical doctors that have been part of our campaign in the past and currently that are creating this type of revenue, earning somewhere between $12,000 to $15,000 a month in their existing practice, that also have an aggregate network that they've built in our organization, where they're capturing another $200,000 to $300,000 to $400,000 a year annually on what's taking place. So these are the numbers that accurately reflect what takes place from a medical practice and the numbers that they're earning themselves, this example. And then here are the reflections of the numbers that as an example, what's earned up to 20 practices. We've had as many, as I've mentioned before in our campaign in the past, as many as 4,500 medical practices, and they vary in terms of their area of production. They vary in terms of their area of commitment, whatever it is that they're doing from a medical perspective, they vary. And you have some that are having great success, and some that are just doing well because they're adding an extra several $1,000s a month of revenue, overcoming some of the challenges with their personal overhead as an entity, and some of the challenges that are related to just paying the challenges that are associated with what takes place in medical practice and any sort of practice that you have. So guys, I wanted to walk through this information to give you an understanding of how Wellness BioSciences has been able to change the playing field. I think what we've been able to do within a relatively short period of time is go out and exercise the understanding that we have and we have had with nutrition, and now parlay that into what's taking place within CBD. And we think that the bridge is very strong, and the aggregate amount of business that we're going to be able to do is going to get much bigger. We'd love to have you part of the program. Please get with whoever it is that allowed you to take a look at this video, and let us find out what we can do to customize our program specifically and directly with you. My name is Barry Cocheu, CEO here at Wellness BioSciences RX. Thank you very much for your time, and God bless.